Okay, let's we're gonna go over the hand washing procedure, which everybody should be very familiar with. Did you get a haircut? Looks awkward.
Nice.
Just kidding.
She sent me thanks, man. At least you're in here.
Do what?
She's saying me thanks.
No.
She doesn't care.
That's right.
Your hair looks awful. Exactly.
Okay, let's talk about hand washing, and then we will go on to this, which now I lost again. I'm thinking about it.
I have a question. You know that vital signs review checklist thing? Were we supposed to have that in last week?
I think it's on the list to do to this week because y'all didn't take as long as I thought you would have.
Yes.
So I
It
think
is.
it's
Awesome.
yeah, it's Friday.
What is it?
The vital signs review worksheet thing you left with all the terms and stuff in it. This is out here. God almighty, Zach. That one.
Just make sure that you check 3 different people.
3.
Isn't that what's listed on there?
No, on that packet, we only had to do one. didn't we?
Yeah. I said 1. What?
You should be. You should have done 3.
All right, oh, it's this one.
Maybe I didn't print out the second page of it. That's probably what happened. Yeah, that part 2 has you have 3 people.
No, this is the one.
Yeah.
We just have part 1.
Oh, y'all haven't gotten part 2 yet?
Part 1. Oh.
She just didn't print the back. I'll have to print that for you. I'll go in the middle of the class.
Are you
print it. You just got 2 more people. It's due Friday. You'll be okay.
No, I was talking
Yeah, see, she just didn't print the back of the where it says part 2. No wonder you probably didn't even know what part 2 was because this is where it says part 2.
Okay. That makes sense.
Okay, let's go over your hand washing procedure.
First.
You'll have to be checked off on that again. And you guys should be familiar with this. Here, we'll practice at our desk. Ready? So remove your jewelry. Just don't know. So, yeah. Just don't forget them. Okay, so again, I'm not a stickler on if you turn it on with a paper towel in the beginning. It's me. It's already dirty. It's already dirty. Warm water. Why do we use warm water? Do it.
Heat kills germs.
Okay.
Get sticky.
And okay, here's the deal. Hot water is only going to kill germs if it's boiling. It has to be boiling for like 7 minutes.
So then it doesn't
You
matter.
have to dip your hands in boiling water for like 7 minutes to actually kill all the germs on it.
It's soapy. So get all the flesh and all that.
Yeah, that would be gross.
That'd be awesome.
So,
Your hands over flesh.
okay, the only thing that actually kills germs is either alcohol, hand sanitizer, or like antibacterial soap. It probably has some kind of alcohol in it. So you get warm water because that's what makes the soap sudsy, remember? And the suds of the soap is what actually rinses off the germs. Okay.
Okay.
So obviously you weren't the only one who thought that. So because when I was in Ethiopia, we didn't have warm water. All we had was cold water. And I think, well, I did get sick one time, but I think that was something unrelated. I drank some nasty water somewhere, but anyway. But that's all we had. But I just had to make sure that we got really, I really got a good lather on my hands. That's the thing, is getting lather. And that's what warm water helps with, is it helps make that water, make your soap lather up really good. Okay, so turn on your water. Make sure it's warm. Okay, wet your hands and wrist. Fingertips pointing down so you don't run dirty water up here, running back down your arms. Soap. Lather on hands, put the palms of your hands together. 15 seconds. What you can sing.
This is the way we
your feet. Watch out.
That's his practice question.
Oh.
Back of your hands.
Every time we get it.
Between your fingers. What are the worst places typically? Your fingernails. In between your fingers, your thumb. I feel like whenever we do glow germ, it's always like this section right back here. Everybody always misses. Wrists. Okay. Back of your hands. I don't know if I did that. Fingernails, rinse your hands, pointing down. Very good. Hopefully you've already done your paper towel. We corrected that part in the beginning. Paper towel.
I did it.
Dry them. How do you dry them?
From
Tips.
Tips to the rest of your finger. So
you got
dry, dry, dry. You don't want to bring this dirty back up to your fingers. Okay. And then make sure that you use a dry paper towel. Why do we have to use a dry paper towel to turn it back off?
if it's wet.
And what happens?
And
You use a
trying
wet
to
paper
get through.
towel. Anything that gets wet is no longer, it can't be clean anymore. It's contaminated. So dry paper towel to turn it back off. Have y'all become like the masters of like navigating in the bathroom without touching anything? Anybody else like that? I can do a lot of stuff in the bathroom, like just my elbows. Get there.
Like fight somebody.
I mean, I can do that too if I need to. Anyways,
You're like that, so.
even Hannah, I told her we were in like Walmart or somewhere one day, and she was like, "I want to flush the potty," and she lifted up her leg to flush the potty. Of course, she couldn't reach it because she's like this tall, but because she didn't want to touch it with her hand.
So what, she just
Yep,
didn't
that's
flush
your
it?
daughter.
She left it?
That's her. What'd you say?
She left it?
She
Couldn't
left it?
reach it. Did she leave it?
Oh no, I just lifted her up and let her step on it.
Oh, okay. You're very wrong.
So I don't want her to touch that nasty thing.
I'd tell
Okay.
that kid to keep trying to bell over.
Come on, you can do it.
Okay, let's go over some of these medical terms that. What are some of the main medical terms? I know y'all been practicing, but we'll go over these again. So those of you guys who are in anatomy, you'll get to go over these again.
Yay.
So you'll know them really well. Okay, so body planes and directions. I forgot to put that every time.
First things first.
Okay, so body planes, purpose of planes. Did we learn the planes in this class last year?
Yeah.
We did, okay. So body planes are just, it's like a plane in geometry. It's just like a flat, I don't want to say line, it's a plane, but it separates the body into sections. So median, which means what basically?
Mid-sagittal.
Well, yes.
Middle.
Middle,
That's it.
medium, if you want to think of it that way. That's the only one that actually separates the body into right and left halves, into complete halves. Okay, it can also be called mid-sagittal. Mid, again, is in the middle of it. So mid-sagittal or median is the only one that separates it into equal portions. Because you think about it, a transverse plane that goes this way, your top part of your body doesn't look the same as the bottom part of your body. So this is the only one that actually separates it into halves. Now remember, you can also, I didn't put this on there, but remember you can also have a sagittal plane that's not necessarily in the middle. So it could run like this way or on this side, but it's still like a vertical plane. That makes sense. It doesn't have to be mid-sagittal, is the one that's in the very center. Okay, frontal or coronal plane. This one is also a vertical plane, but this divides the body into front and back portions. Not necessarily right in the middle, because again, the front of your body doesn't look the same as the back of your body. So not necessarily in half per se, but it just runs that direction. Divides it into front and back portions. This is a good picture of a coronal plane because this is, I'm horrible with CAT scans and MRIs, but
The snake. No,
it
it's
looks
fine.
like a,
It's fine.
to me, CAT scan, but I'm definitely not the radiology expert. Yeah, this is scoliosis. The S-shaped spine, that's scoliosis. So, well, you can see the lungs really good there if you are right here. This is the liver. It's just, you can't see this other section because of where it's out this direction. This looks like probably part of the stomach. You can kind of see the little squiggly lines in there, the rib. Anyways, but does that make sense? This is one of the main things you'll hear the word plane used for is in CAT scans or MRIs. Transverse plane is one that's used really frequently. This is a coronal plane. Yeah, that's a pretty severe scoliosis. I don't know what degree it is, but okay. And then transverse just divides body into upper and lower portions. That's pretty simple. Trans means what? Well, transform is, that's what trans is. Not change. Opposite is contra. Trans means across or through. Like transparent, see through. I don't know what parent means. Trans. That's not. That's change. I can't think of anything trans. Trans.
Continent.
Do it.
Continent. Transcontinent. Transcontinental. Goes through the continent.
There you go. Trans. Oh, and we probably watched. I don't even know if this one's still good anymore. We watched this before, but I'll show it to you again anyway. So here's a good transverse. Thinking MRI on this one, but again, not really sure. But what they've done is you can see they're taking out little slices all the way down their head, or up their head, I guess they're actually going. So look, here's the eye sockets, see the ears over here, and then it just keeps moving. There's the tumor right there. But that's what it is. It's just showing you a picture of slices all the way up.
How to do that?
Tumor.
You get slices on the inside of the head.
I just don't. It blows my mind how they ever even came up with things like this. Like, how did you know they would do that? Okay, so now we've got the next terms are anatomical terms. Talk about planes. 3 types of planes are what again?
Transverse. Median.
And sagittal or median. Coronal or
Frontal.
Frontal. Okay. And sagittal. And Hannah's writing her H's. It's more like drawing her H's. She's like down, down, across. So medial means moving towards the midline of the body. So that is towards the center of the body or the middle of the body, if you will. Okay, what's the opposite of median? Or medial, sorry.
Lateral.
Yes. Okay, so this is the medial aspect of the ankle. Okay, here is the toe of the big toe, the inner ankle. That's the medial aspect of the ankle. So they're looking from this direction. So your big toe would be medial, your pinky toe would be lateral. Laterals towards the outside. And I always remember lateral because it's got these two L's and they're like they're towards the outside. I don't know.
Oh, yeah.
So do what?
Clean.
Oh yeah. Anyway. So what else? Anatomical, and remember, this always relates to the body when the body's in anatomical position. So even if I've got my legs crossed like this, and the inside of my ankle is actually to the outside of my body, that's still medial because all of those terms always refer to the body in anatomical position, which is basically like this. So thumb is lateral, pinky fingers are medial. Does that make sense?
Like,
Ears are left, and your fingers, because anatomical position is like this.
Oh, okay.
So it doesn't matter which way I cross my arms, whatever, they're still the same. Okay, anterior or ventral means towards the front. So what are some body parts that are anterior?
Nose.
Your nose, kneecaps, nose,
Your belly.
eyes, belly. So anterior or ventral. And remember, anti, this is a prefix that means front or before. Before. Anti, A-N-T-E. Like the antecubital space. Is this space on your elbow? Or do you put in? Think
Yeah.
A-N-T-E. Okay, posterior is towards the back or dorsal, like dorsal fin. Posterior. And post means after. So like post-operatively means after surgery. P is the abbreviation, if you'll remember, for after. So post is towards the back, posterior. Okay, superior and inferior. Superior is towards the head, inferior is towards the feet. Even if I'm standing on my head, it's still not ignorant. It always refers to anatomical position. Superior, inferior, that was pretty easy to remember. Now remember, these are always in relation to each other. So I could say, for example, my knees are superior to my ankles, but my knees would be inferior to my hips. Does that make sense? So we can use those in reference. Okay, distal and proximal. So distal means away from the point of attachment, so it's distant, it's away. So for example, my hands, you can consider those distal, okay? How do you want to do that? Again, this one's in relation. So like my elbow is distal to my shoulder, but it's proximal to my wrist. Makes sense. So distal is distant, away from the point of attachment, wherever it attaches. Proximal is near, it's in close proximity, if you want to think of it that way. Now, the only other, typically you only use distal and proximal when you're talking about your appendages, like your arms or your legs. Otherwise, you'll use superior and inferior. That makes sense. Typically for like trunk or head, you use superior and inferior, and then arms and legs. Now you can also use distal and proximal if you're talking about like a tube in your body, like the proximal end of your small intestine. That would be like the point that's nearest, like the point of attachment, if you will, or the beginning of it. Does that make sense? So if like I'm talking about the small intestine up there, you know, that would be proximal, this end would be distal. Does that make sense? Okay, this example just gives you, I put this one on here because of the phalanges. So your phalanges are your finger bones. So this little section right here is called your distal phalange. This one is your proximal phalange. This one's middle. So, that makes sense? Good. Superficial means near the surface, or it's really shallow. So like your epidermis is superficial. You have veins that are superficial. You're thinking of your chest, your ribs would be superficial in comparison to like your heart. So superficial is just shallow or near the surface. Like, let's say you fall and scrape your knee, that would be like a superficial abrasion or cut or whatever. Okay, deep, pretty obvious what that one is. That's just away from the surface. So, oh, it doesn't get a brain power. And we don't actually need homeostasis. Let's look at, well, I guess we can just go back through it anyway. Homeostasis, maintenance of a stable internal environment. So it's just your body's ability to maintain its norm, basically, to run at a normal level. Now, some people, homeostasis may look a little different for different people, but for the most part, everybody's body pretty well runs the same way. I mean, it should run the same way as far as hormones go and everything else. So when we're in homeostasis, our body's needs are being met, it's functioning at its normal level, and every system has a role. You guys know. No, y'all haven't done that. Okay, the abdominal quadrants. These are pretty simple. Okay, you just basically make a cross at the belly button, right upper quadrant, right lower quadrant, left upper quadrant, left lower quadrant. Okay, pretty. Now, always keep in mind though, it's on them. So you're always talking about the patient's right or the patient's left. So if you're looking at a piece of paper and drawing it, just remember you've got to put yourself as far as right and left go. It's always theirs. No matter what direction you're facing them, it's always their right and their left. Okay, so don't get that mixed up whenever you go to get to the test. Just keep in mind it's their right, their left. Okay, this is pretty simple. What are some reasons we might use these?
They're like show or something.
Like surgery.
Okay.
Like,
Yeah.
so you tore one of those.
Okay, good.
So,
Pain is a big one. They'll, if like you go to the emergency room with stomach pain, they'll like mash in each area, and that's how they'll say, okay, they've got tenderness in the right upper quadrant or whatever. Quadrants are really good if it's kind of vague. Usually pain is kind of vague. You can't just pinpoint like a 1-inch spot of where your pain is. It's usually just kind of, it's in this area, or it's in this area, or it's all over, whatever. Like a kid, scrape their knee. Abdominal regions are a little bit more specific. Did we go over these in this class last year?
Yes, we did.
I go over this in every one of my classes, so I have trouble remembering. Okay, so these are, you'll remember, right, hypochondriac. What does hypochondriac mean? Hypo means what?
low.
Below. Chondro means, what does it say? Hyper is excessive.
Yeah.
Hypo is low. Chondro is what?
Cartilage.
Cartilage.
It is cartilage.
It is
Okay.
cartilage.
Cartilage.
So the literal meaning is below the cartilage, which you think about it, you've got your ribs have all that cartilage around them. So you think of it that way. The cartilage. I don't know why people are called hypochondriacs whenever they feel a little bit like makeup illnesses all the time, but so you have your right hypochondriac and your left hypochondriac. Those are the top ones on the edge. And then the other edges, you've got lumbar, which coincides with what?
Sides.
Sides. When you hear the word lumbar, what do you think of?
Lumber.
Somebody says, oh, I'm having lumbar pain.
Like lower
neck of your back. You know how in some cars you'll have lumbar support? Ever heard that word?
Oh, yeah.
Yeah.
Some cars have that, like you can turn a knob and it makes the lower part of the back move, like you can move way out or move in.
Yeah, Denver
Some chairs have
turns mine up real high all the time.
I keep mine as high as it'll go, it's not back arches so much, but lumbar is just that section of your back where it arches. So, and we learned the spinal sections last year. I'm pretty sure.
Easy.
So lumbar is just this lower part of the back. So it coincides with where these are. Think about that. The lumbar region's in the middle, and it moves, it's in that same area as that part of your back that arches. Okay, and then the lower ones are the right and left iliac, or what's the other word? You remember? It also starts with an I. Inguinal or inguinal.
Yeah, never
I
get
better write it down.
Yeah, no, I'm used to it.
I actually hear this one more than I hear this one.
iliac
Because
spine.
inguinal, sometimes you'll hear about people getting inguinal hernias. And that's what it's called. That's that area, kind of the groin area. So it can be called iliac or inguinal. Okay, then we've got down the center, we got epigastric. Epi means,
Above
and gastric means
stomach.
stomach. So we'll change it to the stomach. So above the stomach, articulates. And then umbilical, what's your umbilicus?
Your belly
Belly
button,
button.
And then hypogastric,
under your stomach.
the lower middle section. If y'all have trouble remembering these, I make, always make flashcards. Let me show you how I make these flashcards. If I can find them. I always make mine.
Good morning, Bulldogs and Dogettes. Hope you had a great 3-day weekend. It's also nice to have a 4-day week of school every once in a while. I just wanted to clarify a dress code issue. Make sure that your shorts need to go to the shorts, I'm talking about shorts, skirts, dresses, etc. need to go to the top of the knees. If you're wearing leggings underneath, then it can go to mid-thigh. Only if you're wearing leggings underneath, then it go to mid-thigh. Teachers, please check for dress code violations and shavers. If there are potential dress code violators, send them to me and I'll make the determination. If someone needs to shave, email his name to Mrs. Mosher, please. Students, I would encourage you to use the 7 phrases of success on a daily basis. If you use the 7 phrases of success, then people will bend over backwards to help you out. The 7 phrases are, yes, sir, no, sir, yes, ma'am, no, ma'am, please, thank you, and excuse me. Other announcements. Students need to purchase a parking pass by Friday. Please see Mrs. Mosher. Also, we'll be allowing students to purchase parking space to paint as well. Junior high student council meeting tomorrow at lunch. And recently, the Cooper Junior High School student council officers, along with Mr. Rome, were challenged to take part in the ALS Ice Bucket Challenge. Of course, they accepted, but first they wish to accept donations to help fight this disease. Student council students will accept donations in the name of ALS starting today and ending next Wednesday, September 10th. After the donations have been completed, the officers and Mr. Rome will participate in the Ice Bucket Challenge during 8th period that afternoon. Here's some information about this debilitating disease. ALS, also commonly known as Lou Gehrig's disease, is a progressive neurodegenerative disease that causes muscle weakness, paralysis, and ultimately respiratory failure. ALS attacks certain cells in the brain and spinal cord needed to keep our muscles moving. Early signs and symptoms of ALS include muscle cramps, twitching, weakness in the extremities, and difficulty speaking or swallowing. As the disease progresses, though, it is characterized the inability to move any part of your body and the inability to speak or communicate with anything but your eyes, and complete reliance on a feeding tube for nutrition. Another announcement, driver's ed, will take place here at Cooper High School when Sunday, September 7th. The time will be from 1 to 3 p.m. in room 200. The cost is $100 for the classroom only. Come by the office to get the information, contact information from Ms. Brasher if you need it.
Please rise and join with me in the pledge of allegiance. First, the flag, and then the Texas flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, God, indivisible, liberty, and justice for all. Now join with me in the pledge to the Texas flag. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one indivisible. Let's pause for a moment of silence.
Okay, this is how I make my flashcards when I'm doing that. So if you need an idea of how to do that.
Right, iliac.
There you go. So, anyways, let me finish this and then I'll give you guys a little break in just a second. Body planes again. Spinal regions, really quick, there's just 5 of these. Okay, so cervical is at the neck. Like your cervical vertebrae. Cervical area, little region. Thoracic, that's kind of the area behind your lungs. I always think of, insects, when you learn like 3 body parts of insects, they have head, thorax, and abdomen. So thorax is just the middle section, the section kind of where your lungs are. Lumbar, again, is that arch where your back arches, lower back. Lumbo, I think, means lower back, because a lot of times I hear people refer, whenever I was working home health, I would code lumbodynia. What would that be? I remember the suffix dynia. I don't know. I'm pretty sure we talked about it, but it wasn't one we used often.
No.
It's the same as, it would be the same as, oh my gosh, my mind went blank for the other word. Oh my gosh. It's pain. What's the other word for pain?
Yeah, like algae or something.
Algia. Yes, thank you. So, dynia is the other word for pain. Algia and dynia are both. So lumbodynia is something I hear a lot for just back pain, just generalized back pain. But anyway, sacral. This is that bone. You're looking at this guy. That is that larger piece of bone at the lower part of the back. It actually is separate bones when your body's forming in the womb, but then they all fuse to make one larger bone. So that's the sacrum. Kind of at the lower part of your back where it curves back out down here, and then the coccyx, COCCYX, is just your tailbone, just the very tip of that bone. So 5 spinal sections are pretty easy. Think about your cervical vertebrae. Cervical means neck. I think we learned that one last year. I know y'all put it on your little body posters for sure. Or it goes right behind the chest, kind of coincides with that. The main body cavities, I know we learned these last year as well, but cranial is spelled wrong, cranial cavity, cranial means what?
Yes.
It's just your what?
Skull.
It's your skull. Okay, so cranial cavity. Remember, cavity is just an open, just space in your body. So same thing whenever you have a cavity in your tooth, it's just an area that's like been hollowed out, like a hole basically in your tooth. So cavity. Cranial cavity is up here where your brain is inside your cranial cavity. Spinal cavity is what encases the spinal cord. And these two together make up the dorsal cavity. Dorsal means what again? Back. Okay, then you have the thoracic cavity. That's where your lungs are, your heart. Coincides with the thoracic spine. So those are the same term, same area. And then your abdominal cavity and pelvic. And together these make up the abdominal pelvic. Pretty straightforward there. And then all of these are your ventral cavity. Ventral means what? Correct. This is why we teach the medical terminology. It's that, I mean, you can figure that out with just words that you know. So, I know that's all reviewed. I don't know if we did spinal sections last year, but we'll do them. We did. Oh, good. I just told you we did last year. Okay, any questions on any of those? It's a lot to review, but it should just be a matter of studying. It should just be back in or something. I'll let you guys take a break.